Capitol Newsroom tonight. Abortion is a polarizing topic in our state right now. Less than a month ago, over 700 medical professionals signed an open letter to Tennessee lawmakers asking them to reconsider the law.
Now, more than 100 of them, future physicians, med school students. State Capitol reporter Chris O'Brien spoke with doctors today to learn more about the lack of abortion access in our state and how doctors are sending patients across the border.
When I talked to Representative Susan Lynn, one of the original prime sponsors of the current abortion law, she said she hopes doctors will tell the political arm to stay out of medicine.
From what I can gather here, you're saying doctors should probably stay out of politics at some level.
I showed a high-risk OBGYN her full response.
Politics should not be involved in medicine. It is about the doctor-patient relationship and the Hippocratic Oath to first do no harm.
I completely agree. Get the politics out of it. Why not then get rid of the affirmative defense? Like, why do you have to have an affirmative defense?
Abortion providers say they're in a tough spot. They're sworn to a Hippocratic Oath, but they also don't want to get arrested.
Do we feel comfortable enough taking on that risk to perform an abortion, or do we need to send the patient elsewhere? And unfortunately, we have scenarios where people are being sent out of state.
In fact, less than a month ago, a doctor in Chattanooga sent a patient on a 6-hour ambulance ride to North Carolina in what she saw as a life-saving move. Tennessee's abortion ban is total, aside from allowing the doctor to perform an abortion in life-threatening situations. However, the onus is on the doctor to prove it was absolutely necessary, rather than the legal system proving it was unnecessary.
The issue with the affirmative defense and the way it's written, primarily from my perspective, is that it is incredibly ambiguous and vague. The statute in itself criminalizes an entire medical procedure without exception.
The impact is far-reaching. It extends beyond just patients. Some say the state is becoming less attractive for younger medical professionals.
For young physicians contemplating where to get their training or where to practice medicine, I imagine this is weighing on them.
Tennessee already has a medical desert problem. The March of Dimes reported in 2020 that nearly 36% of Tennessee counties are maternity care deserts.
I think we're going to see potentially more physician deserts than we already have.
Medical providers will survive. Both Dr. Zeit and Dr. Osmundson say they won't stop practicing medicine. But if it comes down to deciding whether or not to potentially commit a felony, it's only natural to err on the side of caution.
I mean, it's just a tragedy of our healthcare system. Like, the fact that, in the United States, we would have to consider sending patients out of state to receive care that, both a patient and her physician feel is life-saving or life-preserving. It's just unbelievable that could happen these days.
In Nashville, Chris O'Brien.
When Chris asked both doctors what they would say to lawmakers if given the opportunity, both said they would urge the legislature to reconsider the law and to at least consider the affirmative defense language and potentially add in some exceptions to it.